Good morning. My name is Susan Reinhardt, and I'm delighted to serve as the Senior Vice President at AARP, directing the Public Policy Institute, as well as serving as the Chief Strategist for Family Caregiving Initiatives and the Center to Champion Nursing in America, which is an initiative of the AARP Foundation, AARP, and the Robert Wood Johnson Foundation. Today, it's really a great pleasure to welcome you to the first in a series of virtual convenings that comprise our Health Equity Action Forums. Today, in partnership with our AARP's Multicultural Leadership and Thought Leadership, which are led by my dear colleagues, Edna Kane-Williams and Dr. Jean Axius, we are pleased to host the value of diversifying the nursing workforce to achieve health equity. We're excited to bring together more than a dozen speakers from across a multitude of sectors, including business, government, academe, social justice, consumer organization, health providers, and others, all of whom understand the valuable role that nurses play in achieving health equity. We're also fortunate to have with us today as our MC, Dr. Kupiri, known as Piri, Ackerman Barger. Piri is the Associate Dean of the Health Equity, Diversity, and Inclusion, as well as an Associate Clinical Professor at the University of California, Davis, Betty Irene School of Nursing. She is also an advisor on diversity and inclusion for the Future of Nursing Campaign for Action, which is also an initiative of the AARP Foundation, AARP, and the Robert Wood Johnson Foundation. During the meeting, you're welcome to post questions in the chat function. And we'll try to answer as many as we can during the session today. But if you leave your email address and have additional questions, we'll be following up with you to answer those questions. The program is also being recorded, and you'll be able to access it on the campaign website within a week. So turning to today's topic, we use the term health equity, and people will ask, what does that mean? The Robert Wood Johnson Foundation defines health equity as everyone having a fair and just opportunity to be as healthy and well as possible. Robert Wood Johnson Foundation goes on to say that this requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality, education and housing, safe environments, and health care. For more than 10 years, the campaign has been committed to ensuring that the nation's 4 million nurses are key to improving health equity and to creating communities in which everyone has access to high-quality health care. We strive for a nursing workforce that more closely reflects the diversity of the population. Increasing numbers of nursing from different backgrounds, including race, gender, and ethnicity, will contribute to better health and health care for all. From such diversity in nursing, it comes a deeper understanding of the elements that affect a person's health and emotional well-being and ultimately improve care and treatment. Before introducing our speakers, I'd like to share with you some data to set a context, some data about our current workforce. This first set of data comes from HRSA's 2018 National Sample Survey of Registered Nurses, and it shows an upward trend of increased diversity, racial and ethnic diversity in the overall workforce. The percentage of Hispanic Latino nurses significantly jumped from 2008 to 2018, from 3.6% to 10.2%. So that's a significant increase for Hispanic Latino nurses. The percentage of African American Black nurses improved from 5.4% in 2008 to 7.8% in 2018. So 10 years. We went from 5.4 to 7.8. Actually, the number of Asian nurses did not change. It actually dipped a little bit. In 2018, they comprised 5.2% compared to 5.8% in 2018. And Native American nurses have held constant at 0.3% of the nursing workforce. So while there were improvements for Hispanic and African American nurses, their representation in nursing still falls short, even there, falls short of the overall population. And trying to put that in context, you need to know what are the percentages of race and ethnicity in the American population. So the U.S. Census Bureau says that Black, and this is 2019, by the way, Black Americans comprise 13.4% of the population. Hispanic Latino people comprise 18.5%. Asian Americans, 5.9%, and Native Americans, 1.3%. Again, these percentages that I just shared with you focus on the overall nursing workforce. And we're also very interested in leadership in nursing. So we look to our colleagues in different parts of the nursing workforce and leadership to see what they knew about academe and executive nurse leadership. We turn to the American Association of Colleges of Nursing, who gave us 2019 data about nursing faculty. And there we see that 80% of nursing faculty are white, 9% are Black, 5% are Hispanic. 5% are Asian, 4% are Hispanic, and 0.3% are Native American. The American Association of Colleges of Nursing could give us the overall faculty numbers, but not necessarily deans and directors. They didn't break it down, but they were able to say that less than 10% of deans or directors of nursing are people of color. We also turn to the American Association of Nurse Leaders. The CEO of that organization is Dr. Robin Begling, who is with us today. And Robin provided us with some demographic numbers about the diversity of chief nurses. The representation of chief nurses and chief nurse executives among nurses of color is even more dismal than in academe. 90% of chief nurses are white, 3% are Black, 2% are Hispanic, 1% are Asian, and 0% are Native American. So these are really difficult numbers to talk about, to think about, but we have to see them. We have to understand why there is such underrepresentation of nurses of color. And most of all, we have to really do something about it. Absolutely pay attention to this and come with actionable solutions. The Campaign for Action's primary dashboard measure a goal for diversity. As I said earlier, that the nursing workforce should reflect the population of America, the general population. And we have a long way to go, even a longer way to go in terms of nurse leadership. So I'm very concerned about these numbers. I'm sure if you're with us today that you're concerned about these numbers, but I am proud that the ARP Foundation, ARP, and the Robert Wood Johnson Foundation and our Center to Champion Nursing in America are committed to making real changes. So that's part of why we have this meeting today and the others that will follow. So let's just turn to our agenda. And I'm now delighted to introduce our two keynote speakers, Representatives Lauren Underwood from Illinois, who is a nurse, and David Joyce from Ohio, whose wife is a nurse practitioner.
Hi, everybody. I'm Lauren Underwood. I'm a registered nurse, and I have the honor of representing Illinois' 14th Congressional District. I'm excited to join you for this important conversation, and I'd like to thank the AARP Foundation, AARP, and the Robert Wood Johnson Foundation for hosting this event and for their leadership of the Future of Nursing Campaign for Action. Your campaign was built on a foundation of understanding that if we want to transform the healthcare system in the United States, our nation's nurses must be leading change agents. There are millions of nurses across the country improving people's lives through clinical excellence, cutting-edge research, meaningful academic roles, and even public service as members of the United States Congress. As we speak, nurses are on the front lines of our nation's response to a once-in-a-century health crisis that has devastated communities all across America. But although COVID-19 has been called the great equalizer, the opposite is true. The pain of this pandemic has disproportionately fallen on African Americans, Hispanic Americans, Native Americans, and other vulnerable communities, exacerbating stark disparities that existed even before the virus started to spread. As we continue to battle COVID-19, we must center equity in our public health response, including the allocation of vaccines. But our work is much bigger than that, and it will take much longer. Even after the pandemic, we will need to confront disparities in maternal health, incidence of chronic conditions, access to care, and more. And we're going to need nurses to step up and lead in this urgent work. To achieve health equity in the United States, investing in a diverse nursing workforce will be essential. And that's why one of my first priorities when I got to Congress was joining Representative Joyce and other nursing champions to introduce legislation to reauthorize Title VIII nursing workforce programs, which was signed into law this spring as part of the CARES Act. but we know there's more work to do, particularly in response to our nation's Black maternal health crisis. The United States has the highest maternal mortality rate in the developed world and the only rate that's rising. The rate of pregnancy-related deaths for Black women is 3 to 4 times higher than the rate for white women, a disparity that cuts across income brackets, education levels, and any other demographic factor. In March 2020, I joined Congresswoman Alma Adams and Vice President-elect Kamala Harris to introduce the Black Maternal Health Momnibus Act, which included 9 bills to address every dimension of this crisis. One of those bills, the Perinatal Workforce Act, included robust investments in programs that offer funding to schools of nursing so that they can recruit and retain racially and ethnically diverse classes of nursing students who intend to specialize in maternal health. By recruiting more Black nursing students and others from underserved communities, we can build a larger and more culturally congruent nursing workforce, ensuring that every pregnant person can receive maternity care from healthcare professionals that they trust. By making these critical investments, we can save moms' lives and end racial and ethnic disparities in maternal health outcomes in the United States. And in August of last year, I introduced another bill called the Future Advancement of Academic Nursing Act, or FAN Act, with Senator Jeff Merkley and a fellow nurse in Congress, Chairwoman Eddie Bernice Johnson. This bill makes a historic investment in growing and diversifying the nursing workforce during the COVID-19 public health emergency and beyond. Specifically, it would provide $1 billion to schools of nursing to enhance student enrollment and retention, particularly for students from disadvantaged backgrounds. The bill would also provide funding to allow nursing schools to build a diverse faculty with a particular emphasis on faculty from racial and ethnic groups that are underrepresented in the nursing workforce. Building on the foundation of the Title VIII Nursing Workforce Development Program, My Perinatal Workforce Act and the FAN Act represent significant steps towards the diverse nursing workforce that will help achieve health equity in the United States. I'm going to be reintroducing these bills in the 117th Congress, and I will need your support to get them across the finish line. As nurses, the high-quality care that you provide at the bedside is only one part of all you have to offer. As members of the most trusted profession in America, your advocacy makes an impact. So, speak out for these policies. Contact your member of Congress and urge them to co-sponsor these bills. Spread the word on social media and continue to host important events like this one. I'm grateful for all the work that you do, and I look forward to continuing to partner with you in the new Congress. I can't wait until the day that we are all back together again in person. But until then, take good care of yourselves, everybody. Thank you.
Hello to my good friends at the AARP, and welcome to their Health Equity Action Forum. They were asking what my priorities are regarding health and healthcare. I can tell you most important for me is modernizing Medicare so that we can lower our out-of-pocket healthcare costs for seniors. Everyone wants those lowered. Strengthening our nursing and healthcare professionals' workforce is especially important, especially in underserved and rural areas. I found in my time that that's one of the hardest areas to continue to attract physicians and nurses and make sure that they're adequately compensated to continue to serve our public. I can tell you that this past year has certainly proved to all of us with the pandemic how critical the health of our nation is to every aspect of our society and our way of life. And so we need to continue to make sure that we have a robust healthcare system to implement the standards necessary to vaccinate our country and to take care of the folks who are ill, unfortunately, and protect our frontline workers that most of the time is our nurses, and making sure that we have a diverse workforce that could help our nations achieve health equity and reduce disparities by making sure that A, they're properly compensated, and B, making sure that the school costs that they incur while they continue to grow in their education are something that work in the public health sector will be something that is being covered. Thank you and have a great day.
Thank you so much for taking the time to spend with us today, Representatives Underwood and Joyce. It is vital for all of us to hear what you hope to accomplish, and it's so inspirational to hear from one of our 3 members of Congress who is a nurse. Now we are going to move on to our first rapid fire panel, in which we are going to ask each of the 5 panelists 2 questions. At this point, I'm delighted to introduce to you our first set of panelists. They are Tari Hanneman, the Director, Health and Aging Program, Human Rights Campaign Foundation. Elaine Ryan, the Vice President, State Advocacy and Strategy Integration, Government Affairs, AARP. Dr. Elena Rios, the President and CEO, National Hispanic Medical Association. Kathy Driscoll, Vice President, Chief Nursing Officer at Humana Incorporated. And our moderator, Dr. Dwayne Proctor, Robert Wood Johnson Foundation Senior Advisor to the President. Dwayne, please take it away.
Thank you, Perry, for that introduction, and it's a pleasure to see you again, and I'm equally as delighted to meet with each of our panelists today. Before I ask the first question, I do want to make obvious what the event organizers did here with the agenda. Today's forum is about diversity in nursing, and each of the organizations you represent are from non-nursing sectors. In fact, there is only one nurse among us, and you, Kathy, are representing Humana Insurance. So let's bridge the points of why is nursing, and especially a diverse nursing workforce, so important to each of your organizations. And how about if we follow the flow of people as you're noted on the agenda? So Tari, you'll be first, then Elaine, Dr. Rios, and Kathy.
Great, thank you, Dwayne. First, I wanted to provide a quick description of my organization for those of you who may not be familiar with it. The Human Rights Campaign is the nation's largest LGBTQ civil rights organization, and the Human Rights Campaign Foundation is the educational arm of HRC, and we work to build capacity, change policies, practices, and hearts and minds in a range of institutions that shape our daily lives. My program specifically works with healthcare organizations, primarily hospitals, through our Healthcare Equality Index, and with long-term care communities, including skilled nursing facilities, through our new Long-Term Care Equality Index. Our focus is to help these organizations adopt the policies and practices that foster greater LGBTQ inclusion to improve LGBTQ patient care and outcomes. And so nurses are really important to us, and a diverse nurse workforce is really important to us because nurses are obviously very critical employees, frontline employees in both healthcare and long-term care settings, and they play a critical, vital role in the patient experience. We know that LGBTQ people often face discrimination, challenges, and barriers in accessing health services. And we feel that LGBTQ nurses can play a vital role in ensuring LGBTQ patient-centered care in a variety of ways. They can help educate their coworkers about LGBTQ patient concerns. They can offer feedback on organizational policies and practices. They can convey to the local community their organization's commitment to equity and inclusion. And I just wanted to kind of touch on a little bit earlier in Susan's presentation, all of those statistics around the diversity of the nursing workforce. I didn't hear LGBTQ. It was largely around racial and ethnicity, and I just wanted to point out and illustrate that LGBTQ nurses span the range of racial and ethnicity. And I want to make sure that when we are talking about a diverse workforce, we are talking about all types of diversity and thinking about LGBTQ nurses along that. So I'm going to now turn it over to Elaine for AARP's perspective.
Yeah, thank you so much. And I have to confess, I feel a real urgency around this conversation. ARP has long advocated for more supports, more authority for nurses. In fact, my dear colleague, Dr. Susan Reinhardt, and we started at ARP on the same day, she educated me early on of the extraordinary deficiencies in state policies that constricted nurses to practice up to the full extent of their education and training. And so, along with our 53 state offices, ARP has worked along with lots of other organizations to advance scope of practice in states across the country. That job is about half done. But one thing that I do want to focus on is that the pandemic that we've experienced together historically has exposed several things. First, there are several disasters going on in this country at the same time. There's the COVID-19 pandemic. There is the pandemic of racism in this country. And there is an economic freefall for millions of American families. And taken together, as we think about our advocacy moving forward, we need to keep all three lenses top of mind. Healthcare and healthcare delivery is going to be essential, not only to fight the COVID virus, but to vaccinate hundreds of millions of Americans. And we have trust issues. We have issues where many communities in this country have the rightful fear that's rooted in a history of systemic racism in this country, where healthcare access has not been equal in this country. And so AARP is working not only today, but will throughout this state legislative session to fight for not only disrupting disparities, diversity of workforces, but also paying workforces what they're worth. And 3 years ago or more, our AARP office in New York launched a project with me called Disrupt Disparities. We looked at the health, wealth, and community disparities for people 50 and older, and then put forth advocacy recommendations to close those gaps. And since that launch in 2017, we've made great progress along with the NAACP, the Urban League, the Hispanic Federation, the Asian Federation. And that work has now grown to 12 states. And so New York is back at it with a release on LGBTQ disparities and what we can do to close the gap. We'll also be launching several other of our recommendations in 2021. But I do want to say this, that people need to see a diverse workforce. They need to experience a diverse workforce. They need to trust a diverse workforce. And only by diversifying what is a dominantly white nurse leadership in this country, only by reaching and stretching ourselves to demand change, can we drive the kind of health equity we need in this country. So thank you so much for the opportunity to share my thoughts. I have a lot of them, but I do want to yield now to Dr. Rios for her comments.
Thank you. I had a little bit of technical difficulty there, so sorry I came in late, but I want to say I'm Dr. Elena Rios, President and CEO of the National Hispanic Medical Association, also the founder with a group of doctors from California, Texas, New York. Back in 1993 and 94 with the Clinton Healthcare Reform Task Force, I was a member at the White House at the time. I think that since then, we have focused our efforts as an organization to help the Latino community improve their health by working with other professional organizations around the country, including the AARP, the AMA, insurance companies, pharma companies, but most importantly, we created a national Hispanic health professionals leadership network that includes the National Association of Hispanic Nurses, the Hispanic Dental Association, the Hispanic Pharmacists Association, Hispanic social workers, dietitians, physician assistants, I can't, on, and mental health workers too. And we've been very cognizant of the importance of all of us sharing leadership information. Most importantly, our own leaders getting that information on how to expand their own career journeys in their own disciplines. And every year at our national conference, we bring them all together and give them a leadership award to encourage them in front of all of their members at their organizations that we all value leadership. And I have to say that because there's so few of us in this country that are Hispanic, that made it out of poverty and have been fortunate to have immigrant grandparents, immigrant parents, and still believe in the American dream of hard work ethic. My grandparents came from Mexico. I was born and raised in Los Angeles, as with my parents. My mother was a nurse. All of us are healers in our communities. We are all very much regarded as community leaders first, hospital leaders if we work in a hospital, academic leaders if we work in a faculty. But there's only 2% of all the nurses that are Hispanic. Only 5% of all the doctors and the dentists. I mean, there is no way we can expand our numbers to catch up to the immense, tremendous growth of the Hispanic population in this country. And it's really, I think, our journey is to help you and everybody listening on how to diversify the cultural competence and language appropriate services in our healthcare system and public health system. We need to work together as a partner. And I think that's the future of diversity. It's not just numbers, it's the quality of the care that's given and the respect to our Latinos, especially our immigrants. And we have gone through a horrible transformation of how immigrants are looked down upon. Public charge was created by this current administration. And we know that President-elect Biden has promised to change immigrant issues. And it's up to all of us as nurses and doctors and dentists to let all our patients know how important it is to get the vaccines and to trust and respect the government for the major effort of Operation Warp Speed and the major efforts of Dr. Fauci and Dr. Azar and all the leadership of HHS and all the pharmacy companies and insurance companies and CVS and everybody else. And I think that that's the goal for us for this 2021 new year. And I'll just stop there. And thank you very much for having me. And now I'll turn it over to Kathy Driscoll.
Thank you, Dr. Rios. And it's a great opportunity to be a part of this panel of leaders and influencers. And I think you're right on target with your thoughts about the importance of collaboration and partnership. As an organization, we at Humana are really committed to taking an active role in driving change to positively impact the lives of our members, our associates, and the communities that we serve. And nurses make up one of the largest portions of our workforce, as with many on this panel today and the panels that follow. And our nurses represent the diversity of the communities that we serve. So they're really crucial to achieving our organizational goals and in driving impact on the holistic health of the people we serve. I'd like to highlight a couple of the important initiatives that we're focusing on. One of the first is Humana's Bold Goal efforts, and those efforts are really focused on addressing the needs of the whole person by co-creating with community partnerships solutions to address social determinants and the health-related social needs for our members and our communities. And they can vary by community, and there's many similarities as well. Our Bold Goal was established in 2015, and it had an aspirational goal of improving the health of the communities that we serve 20% by 2020 and beyond. And we use a measure of our progress that we're making on impacting health, the CDC Healthy Day survey. Our nurses, our nursing community have played such an important role in helping to improve these measures. Nurses, as the most trusted profession for now 19 years in a row, are an important part of how we both identify needs, understand the needs of individuals in the communities that we serve, and really start to understand their barriers to health. Nurses are the folks that engage with our members. They're the folks that help to find the solutions that support health and well-being. So it's so important that we support our nursing community and that our nursing communities understand the communities that they are supporting. And one other important step forward, in December of 2020, Humana announced a commitment as a founding company of 110, which is an organization of over 38 American industry CEOs who've committed to a 10-year focus on the training, hiring, and promoting of 1 million Black Americans to enable opportunities and skills that are needed for family-sustained jobs that have opportunities for advancement. So the launch of 110 is another meaningful step that we're taking towards advancing Black and all diverse talent, for helping us to bring our human care, our Humana's human care promise to life, while strengthening the communities that we serve. And although we've made progress, we know there's so much more that needs to be done. And our community of nurses is such a crucial and influential part of that. So I'll send it back to you, Dwayne.
And thank you for that. And thank you for those insights. On behalf of the audience, I get to thank you for those insights and perspectives. They're really good. And so now let's go on to the second question. How can others work with you, or how can you work with each other, as well as a wide variety of sectors, to help further the diversity of nursing? We'll go in the same order as we did before. First, Tari, then Elaine, Dr. Rios, and Kathy.
Great. Thank you again, Dwayne. I think that one of the most important ways that we can further the diversity of nursing as it relates to LGBTQ nurses in particular is to make sure that the organizations that nurses work for are seen as welcoming and inclusive places for LGBT people to work, and for them to bring their authentic selves to their work, so that they can do all those things that I mentioned earlier in helping advance LGBTQ care. The federal government and more than half of U.S. states do not have employment non-discrimination policies that include sexual orientation and gender identity. So in many states, it really falls on the individual employers to make sure that their non-discrimination policies are fully inclusive. Yet in the Healthcare Equality Index, we found that only 63% of the healthcare facilities that we researched had these inclusive non-discrimination policies, compared to about 100% of those that participated in the HEI. So therefore, I'm going to go with the how organizations could work with us lens, and encourage healthcare facilities to reach out to us, because we have the tools and resources to help them adopt these fully inclusive non-discrimination employment and patient policies. And better yet, I would encourage them to work with us and participate in the HEI, which would help them make their healthcare facility more LGBT inclusive for both their patients and their employees, particularly nurses. So that's what I'm offering today in terms of how we could encourage and promote the diversity of nursing, is through making more inclusive employers where nurses are going to be working. Back to Elaine.
Thanks so much for that. And you certainly have our commitment to work with you along the way in state legislatures and in advocacy across the country. I do want to go back to a couple of points, and I'll try to be more brief in my comments, but I do want to say this, that you know the statistics. African-American Black communities are 3 times as likely to be COVID positive or to die from COVID. Hispanic, Latino, twice as likely. We see devastation in communities of color across this country due to COVID. In one effort that ARP undertook and is still engaged in, which is the loss of life of people living and working in nursing homes. To date, we've lost more than 131,000 residents and staff who have died from COVID in nursing homes across this country. Almost 40% of everyone who died in this country died in a nursing home. And we know that the staff who work in those nursing homes are also people of color, and they have died in record numbers. They've died because of no sick leave. They've died because of poor PPE. They've died because of community spread. And in order to build a diverse workforce, we need to respect a diverse workforce. We need to offer them benefits. We need to pay them appropriately. We need to lift up nurse leaders to lead in the community with us. And so ARP in 2021 and beyond will be launching a national advocacy effort at both the federal and state level to disrupt disparities, to build equity. And that's going to take us addressing things from the healthcare sector to the financial services sector, the economic sector, to build back communities stronger. And so my offer here is that as we launch our national federal state agenda to disrupt disparities and build equity, we need everyone. And ARP is a piece of that. There are organizations across this country who have been in disparities advocacy for decades. And we need to respect their work. We need to lift up their ideas, and ARP is committed to doing that in every state legislature across the country and in Congress, because we need a sense of urgency. We are losing future leaders because they're dying from this pandemic. We need to stop the deaths. We need to build back equity, and we need to take action now. So thank you. And Dr. Rios, apologies for all that time I took to say those words.
Oh, no, I think that's great. I look forward to continuing to work with AARP. We have been working with AARP on a COVID educational campaign this last 2020, where we actually worked together in collaboration with the National Hispanic Medical Association monthly COVID-19 briefing series that we started last May. And we are continuing that this year and look forward to inviting all of the organizations on the call and those in the audience to consider providing a speaker. We just ask for our speakers that they have experience working in the Latino community so that we can pass on strategies that work, whether it's media, messaging, vaccine hesitancy, what are the real barriers to talking to Latino patients? And we know that nurses have that answer because they're the ones that spend the most time with people that are sick, whether it's an emergency room or in the hospitals or in our clinics and medical offices. So we look forward to continuing that education. The other thing, and I'll just mention quickly, I mentioned how we are an organization very much interested in developing leaders. And one of the ways to do that is by mentoring. So for example, for research, we have brought together senior researchers who do research on Hispanic health with junior researchers who would like to get involved in a career in health disparities research. Whether it's LGBT, immigrant health, women's health, children's health, we look at everything through the lens of our community just so that we can produce more mentoring that acknowledges the importance of that for leadership development. And I think in the nursing world, we have also provided scholarships to nursing students, just like public health students, medical students, dental students, because we know we have to give back and uplift those students that have actually made it out of high school, made it out of college, and made it into the graduate professional schools of this country. And we've developed databases. I'd like everybody to know this. It's very critical. You can't do anything without having the human capital. We've developed a database, and what we've done with the Hispanic nurses, for example, is we give them our database. We give them all the applicants that come to our scholarship program, and we ask them to choose and select who they think are the best nursing students to get the scholarship. And we can do the same thing with other organizations, help to develop our mentoring program in collaboration with your students or your graduate students, the next generation, but give them an opportunity to actually meet professionals like them, whether they're Hispanic or Black. We want to work with everyone. So Anyway, I'll pass it back to Kathy. Thank you.
Thanks, Dr. Rios. And, as we've discussed, collaboration, innovation, partnerships are really key to improving healthcare outcomes, to improving access to care, increasing efficiencies, and importantly, making healthcare more affordable. And, we've really discussed some of the ways and the significant roles that nurses can play in those areas. So I think that recognizing the value of the nursing profession, supporting the promotion of diversity in our workforce is really a key for the future of healthcare and the future of health in our country. A couple of thoughts on partnerships that came to mind. As the COVID-19 pandemic has really swept through the nation, nurses have really been affected. They're those who care for those in need. So one of the things that we've done as an organization, our Humana Foundation has joined in the effort to support nurses through donations to the American Nurses Foundation, the Coronavirus Response Fund for Nurses. And these are financial, education, and well-being support initiatives. And I think, not to underestimate at all financial or educational, but, thinking about the well-being of our population and supporting our nurses and other clinicians for all they're doing and going through will be so important now and in the future. So this is a fund that really is available to those who are dealing with and have been impacted by COVID-19. So I invite all to join us and learn more about these efforts, whether you're supporting the foundation or whether you're availing yourself of resources that are there for nurses, for our nursing population. Another partnership that we have with ANA that we're very proud of is the Healthy Nurse, Healthy Nation initiative. And really the crux of that and the goal is to prioritize the health of America's 4 million nurses, because only by improving the health of all of the nurses, all of our nursing community, can we really think about transforming the health of our nation. And then finally, we've really recognized the importance of partnerships with educational institutions and how critical they are in supporting the development of a diverse nursing workforce. Dr. Rios talked a little bit about that, and really that's key to advancing our profession. For example, Humana has a strong partnership with the University of Houston's College of Nursing, and we're working together on some innovative solutions to advance the profession and really to help prepare our next generation of nurses who can support the communities that they live in. And that's a real goal at University of Houston. Some of our most recent collaborations were around telehealth experience for UH nursing students, exposing them to care in virtual settings. And we're just starting a new nurse residency program where we'll admit our first 2 University of Houston nurse residents in March as new Humana associates. So in addition to University of Houston, we're initiating some additional partnerships with historically Black colleges and universities like Simmons College, Howard University, and Kentucky State University. Again, thinking about the importance of mentorship, scholarships, and employment opportunities, and focusing on eliminating structural barriers that exist there. So I think the opportunity for collaboration and partnership are endless. I've taken notes during this presentation as well, and reaching out to my fellow panelists, great ideas. And I really look forward to more discussions like this and collaborating around solutions that really help us to understand the barriers that exist, to take action, and to leverage our nursing communities to move the needle on inclusion and health equity. It's so important, and I invite everyone on this call to provide feedback and to join any of us and all of us in our endeavors. Such an important topic, and I thank everyone for the opportunity to be here. Back to you, Dwayne.
Yes, thank you. Wow, that was so impressive. And, on behalf of the nation, I want to thank all of you all for being so open to collaborate and to come together around these important issues. It's really important that we take our steps forward together. On behalf of the Robert Wood Johnson Foundation, I would like to thank each of you and all of the participants today in joining us for this very important conversation. As you know, RWJF is committed to building a culture of health in America and achieving health equity. And yes, having more clinicians who reflect the lived experiences of our communities is very necessary to doing so. An expert and diverse nursing workforce is as important to achieving health equity as health policies like the Affordable Care Act. Many people with lower incomes still lack coverage, and we encourage organizations and others to be involved in Medicaid and Medicaid expansion. It would be terrific to have all of our national nursing organizations and other sectors engaged in this noble, noble enterprise. At this point, I'm happy to turn this back over to Dr. Ackerman Barger.
Wow, what a wonderful panel presentation. There's a couple of things that really stand out to me. One is that when we're looking at the news, we see so much division. Yet through the panelists and through the conversations, we really start to realize how connected we actually are. And this is in terms of the impact of health, particularly related to a pandemic. We are all connected, right? And the other thing is that we have to come together as healthcare profession, as a country to solve some of these really intense healthcare issues. And to talk about that with me now, I would like to introduce Dr. Winifred Quinn. She is the Director of Advocacy and Consumer Affairs with the Campaign for Action. Hi, Win.
Hey, Peary, thank you so much for being our MC today and for your very wise words there and insight about here we are having this amazing conversation about working together in this context of a very, very challenged nation. And I have a lot of hope and a lot of promise from what we heard today, and even looking at the chat that's going on and the conversations, the questions that are coming up, and also the dialogue that's occurring between the 200 or so folks that have so far joined us today. So I do want to thank everybody for joining us. I see folks from our state action coalitions. I see people from our Equity, Diversity, and Inclusion Steering Committee. I see people from our Champion Nursing Coalition and Council. So it's really quite an honor to have you join us and for you to participate even in the conversation. Peary and I are going to talk about some of the questions that were raised in the chat. And I actually also got a direct text question from somebody who was very smart to do that. And they probably didn't even know that I'd be bringing that question to the forefront. But I do want to cover a couple of very small, shall we say, logistics questions first. In the beginning, people were saying that their computers were freezing or the audio froze. I was not experiencing that, so it's probably that person's Wi-Fi connection. So that's one thing to know. Another is, will this presentation be on our website or be available? Yes, it will. Ada McCallion provided the website address in the chat. It is www.campaignforaction.org, and then just hit /webinars and you'll get there. And then there might have been another logistics question, but for the topic related questions, what I first wanted to talk about, somebody raised the question about the diversity in nurse anesthetist programs, and I'm hoping that I could expand upon that question too and add the diversity of all APRNs. And I don't have that data, but the person who asked the question added data, and that is in nurse anesthetists, the racial and ethnic composition of the 54,000 CRNAs in the country, just 1.3% are Black African American. 2.7 are Hispanic, 0.7 are Asian Pacific Islander, 0.7 are Native American, and 89% are white. So, and that's according to the AANA 2018 profile survey. So, please speak about the lack of diversity in nurse anesthetist profession in the high-level discussions and in strategic planning. So, Piri, do you want to chat about that for a bit?
Yeah, I mean, I have to say that one of the wonderful things about this coming together is that we can highlight some areas that haven't had enough airtime. And I honestly didn't realize until this individual is posting some of the statistics there that there was such a disparity with nurse anesthetists. And, I think that there are probably multiple issues that we need to look at. I mean, there's the broader look of health professions, higher education, then there's nursing, and what is happening specifically in terms of opportunities for nurse anesthetists. And I honestly don't know what the answer to that question is, but I really appreciate that question, and I agree that we need to be including this specifically in our overall strategic plans. What about you, Wynn? What were your thoughts on this particular issue? And is there something that we can do from the perspective of the Campaign for Action to put more eyes on this particular topic?
I do. And I'm going to go back to a topic that Dr. Rios brought up, and that is mentorship. And we do have a really promising and very successful so far mentoring support program with historically Black colleges and universities. We will next month have one with Hispanic serving schools, and sometime in the next several months, we will also have a program with Native American serving schools. And the same goes for, and that's the mentoring programs are to help nursing schools retain RN or BSN level diverse nursing students, so that we can populate more of nursing, so that it's more diverse in terms of race, ethnicity, and gender. And I do want to go back to a point that Tari Hahnemann brought up too about LGBTQ. But mentoring, the other thing I wanted to say is Dr. Lena Gould, who is participating in the chat, and maybe it was even Lena who asked this question. She has an amazing mentoring program for nurse anesthetist students. And it is to diversify and to bring in more nurses of color into the nurse anesthetist field. And if people do not follow Dr. Lena Gould, Gould, please do so. She is one of my favorite social media contacts. She's on Twitter mostly. I think she's also on LinkedIn, but I often see her on Twitter. But I think that the mentoring work that we do at the BSN and RN level can also be expanded in the future to include APRN programs. And we also actually hope this year to work with others in the community, starting with Rutgers School of Nursing and a couple of DNP students who would really like to work on nursing mentorship in practice, so that we increase the number of diverse leaders in practice, in nursing practice. So to address the challenge that Susan underscored, that only about 10% or less of nurse leadership in practice settings is comprised of people of color. Piri, do you want to talk about the LGBTQ population? Yeah. Okay, great.
Yeah, so this has been interesting because I have had multiple people ask the question, what is the percentage of nurses, healthcare providers that are from the LGBTQ plus community? And I'm not sure, and I am open to being wrong about this. I hope I'm wrong about this, but I don't know that we have that data. And one of the things that's been difficult is that a lot of schools are not asking specifically whether people fall into LGBTQ plus community. I think that there's still this thought that maybe it's not okay to ask people that personal information. And so I feel like that there's a gap in the data there. And I think that we need to have this number so that we have a sense of, where are we and where do we need to go in terms of making sure that there's representation for our patients who may be from the LGBTQ plus community.
Yeah, excellent point, Piri. And so a couple of things about data. So I'm going to come right out there and let folks know that I am gay. And so this is something, the paying attention to the LGBTQ community over my adult life has been very important to me. And something I often hear from researchers is that it's difficult to survey the LGBTQ community because historically people would not identify as such, even on surveys. And I have a feeling that more and more people would be willing to identify as LGBTQ, and I would love to, hopefully, would love to see more researchers purposefully ask that demographic question, because we do need to understand more about the LGBTQ health status. Tari Hahnemann shared some information. Tari Hahnemann from the Human Rights Campaign Foundation. And so, and we have one of our researchers, one of our consultants is a researcher, Joanne Spetz from UCSF, and she helps us manage our dashboard measures. We probably at this point would not be adding the LGBTQ population or nursing status to the dashboard measure. But if we're going to create a new one in the future, we would hopefully add the LGBTQ nursing status there. But I can ask Joanne to explore what surveys we can look at. Would it be the American Community Survey? Does HRSA include the LGBTQ demographic question on the national sample survey of registered nurses? I don't know. So that's a question we can explore also. So, but it is about research, coming down to research. Another option to explore how to emphasize the importance of including more LGBTQ nurses in workforce and leadership is there's not currently a national organization specifically for LGBTQ nurses. However, GLAMA, it's a name I love. It was once known as the Gay and Lesbian Medical Association, but it's GLAMA. They actually have a nursing sector in their membership. And I have a meeting on the books in the next month to talk with Hector Vargas, the executive director of GLAMA. And we are going to explore how the Campaign for Action can incorporate and include the LGBTQ nursing workforce in our work. Okay, so a question that has come to me through text, and this Stacy also just sent me another question, but Stacy Manning texted me, and she said, so many colleges are finding that there are too few Black and brown nursing educators willing to take less pay to teach in CON, in colleges of nursing. How do we attract and retain diverse nursing faculty? So I have some ideas there, Piri, but I will throw it to you first if you want to chat about it.
Yeah, I mean, it's hard to overcome a pay issue, right? I mean, all of us care about the pay issue. So, obviously we need to work towards pay equity. But this is a topic that I actually have done some research on with my school. We did a survey where we were asking people what were the things that brought you to teaching in your profession. A lot of times, we talked about mentors earlier. It was somebody saying specifically, this is something that you would very likely be good at and that you might find enjoyment with. One of the things that came out pretty clearly is that people that are in education because they love teaching, and it feels like part of their mission and part of their calling to give back, and potentially, recognizing that there are so few faculty of color that we as faculty of color want to come in and provide this service. Um, and we also have faculty of color who have experienced marginalization and would like to see the academic setting be different and feel like they can influence that. That said, we can have faculty that want to come in and make changes, but what we really need to do is at the institutional level, at schools of nursing, make sure that we have strong strategic plans related to diversity, equity, inclusion, and action plans that follow that, so that when our faculty are, uh, trying to promote or, merit and promotion, or when people are trying to create initiatives that would make changes in the institution, that the institution is backing that. We don't want our faculty of color to feel like they've been tokenized, right? And
Okay.
so that means that we have to have a concerted effort to make sure that people are welcome, that they feel included, that their voices are heard when they're in the academy.
That's really great. I'm so glad you answered that question because you had the hands-on data right there. So thank you, Piri. So I think we're ready to go on to the next panel. So I'll turn it back to you.
Okay, so how about if I introduce our next panel? All right. And while the last panel purposely did not include nursing groups, this time we wanted to hear from a few of the organizations who are on the Campaign for Action's Equity, Diversity, and Inclusion Steering Committee, along with representatives from 2 social justice organizations. We have Dr. Martha Dawson, Associate Professor, University of Alabama at Birmingham, and President of National Black Nurses Association. Miss Erica Colon, Milwaukee-based local leader of the National Association of Hispanic Nurses. Miss Sandra Littlejohn, President, National Alaska Native American Indian Nurses Association. Dr. Jermaine Smith Baugh, President and CEO, Urban League of Broward County. This panel is moderated by Edna Kane Williams, AARP's Senior Vice President, Multicultural Leadership. Ms. Kane Williams, thank you again for your multicultural leadership sponsorship of the campaign's Health Equity Action Forum. It's been so great to work with Yvette Pena on our planning committee and to learn more about what your team and AARP does in terms of engaging multicultural audiences. Edna, please take it away.
Thank you, Piri. I'm delighted that Multicultural Leadership is supporting this event today. This is an important discussion, increasing the number of nurses from African American, Black, Hispanic, Latino, Asian American, Pacific Islander, LGBTQ, and Native American communities. We know that within these communities, there's a great deal of mistrust. It's well-founded. Historical incidents like Tuskegee and Henrietta Lacks and the use of her cells without her permission, as well as more recent events, has really led to an enormous level of mistrust within multicultural communities of the healthcare system. Increasing the number of nurses from these communities can help ease the situation and can help us in our current environment of needing to persuade communities of the benefits, for example, of the COVID vaccine. Right now, many are suspicious. There are levels of miscommunication, misconceptions. And again, more nurses of color more nurses from multicultural communities can help. We've assembled a really interesting panel this afternoon to talk about what their organizations are doing to promote these conversations, because conversations and collaborations within these organizations is key to improving the current situation and key in increasing the number of multicultural nurses. First, I'd like to turn to Martha Dawson, who's with the National Black Nurses Association, to hear from her about what her organization is doing to foster increased representation and to really outreach to these communities.
The National Black Nurses Association was established in 1971. Our founders created NBNA as a leadership organization to address health disparities in our communities and to improve health outcomes by community engagement and partnership. In May of 2020, after the pandemic started, NBNA partnered with the Rainbow Push Coalition against COVID. This group consisted of the National Medical Association and activist groups, as well as others. The goal was to address through a manifesto issues that was emerging in the Black community around COVID-19. We was pushing for increased testing, social distancing. Also, we wanted to make sure that the data was being looked at and reported accurately. In addition, the manifesto also addressed incarcerated individuals, foster care, also our older adults, and especially those that was in nursing home. We took it upon ourselves to help inform the public that we had to protect our older adults, especially those in long-term care facilities, because they was already in a protected environment. So when they were catching COVID-19, that meant either the staff was bringing in the virus, other vendors, or family members. So we had to really step back, lean in, and explain this to everyone within our communities. Then in October 2020, as they were developing the vaccine and becoming closer to getting ready to prove it, another group emerged, and that was the Black Professionals Against COVID. This group consisted of the 4 historically Black medical schools and their presidents, the National Medical Association, the National Black Nursing Association, and the National Urban League, along with blackdoctor.org. We started holding town hall meetings to help to inform those individuals within our community. This was not just your typical town hall meeting, but it was designed to try to answer target questions. And we allowed participants to phone in or either to text questions to panelists. At one of our town hall meetings, we also had Dr. Fauci to participate, and one of the scientists that helped to develop the vaccine. So you can see NBNA is in every space. We do believe in collaborating. What was so important about the Black Professionals Against COVID Coalition is that when we started back in April, just collecting some data through blackdoctor.org, many of the members who was attending from our community at that time, 60% said they would not take the vaccine. In December, when we did another poll, the survey reported that 42% said they would not take the vaccine, and 28% stated they wanted more information. So we're definitely moving the needle forward, and we are very excited about this. So the National Black Nursing Association, both at the national level and throughout 114 chapters in 34 states and DC, we are constantly working with our partners. We work with not only the Urban League, but the NAACP, the National Council of Negro Women, fraternities and sororities. We work with police department, fire department, faith-based organization, and we work with schools, from everything from elementary school all the way through high school. And we have a very strong mentoring program for nursing students. We believe that it is extremely important that we work with people across all spaces. So whether we are talking about pharmaceutical companies to help us to educate, if we are talking about other vendors to help us to reach into our communities, then we do that because we understand that working with others can move the needle forward much quicker than working alone. That is also why we are so glad to partner with AARP and also the Robert Wood Johnson Foundation, as well as many other organizations. So thank you again for having me.
Next, I'd like to turn to Erica Colon of the National Association of Hispanic Nurses to hear about what her organization is doing with others to improve the representation of multicultural communities within the nursing profession.
The Campaign for Action and AARP can definitely help nursing organizations and social justice organizations in helping us amplify our voice and reach greater audiences. A lot of work is happening at the local level, and we have great challenges sharing this work with other communities. This really does not allow us to move the needle as fast as we can or as fast as we want. The campaign has greater access, has greater audiences, has better resources, and really can help us create much more powerful product to reach out the community in general. Most recently in Wisconsin, during the election, the Greater Milwaukee chapter of the National Association of Hispanic Nurses and the Black Nurses Association partnered with a steering committee to ensure safe voting. We provided our expertise and infection control and our voice to ensure that voting was safe for marginalized communities and that the risk and fear of being ill with COVID did not hold people back from coming to vote and be active in the community. So we can continue to partner. There are a lot of opportunities to do that at the local and the national level with collective efforts and eliminating duplicative efforts.
Sandra Littlejohn, from the perspective of the Native American community, what is your organization doing and how are you working with other nursing organizations to improve the situation?
Hello, I extend a sincere Wopida Tanka, which is thank you in Dakota, to the team at the Center to Champion Nursing in America and AARP's Multicultural Leadership Team, along with each of today's presenters who are sharing their wisdom with us. Some of you may not be familiar with Nana Ina, so I would just take a moment to highlight our purpose and mission. Nana Ina is a committed group of individuals from across the country dedicated to the health and well-being of American Indian and Alaska Native people. We are vested in raising the health of our communities and to advance our nursing profession. Nana Ina has partnered with many organizations through the years to further our mission as Native nurses. One collaboration that has been sustained over many years is our connection with other ethnic nursing associations. Nana Ina is a founding member of the National Coalition of Ethnic Minority Nurses, also known as NCMNA, which includes 5 ethnic nursing organizations. And that is the National Black Nurses Association, the National Association of Hispanic Nurses, the Asian American Pacific Islander Nurse Association, and the Philippine Nurses Association of America. This coalition formed in 1997 toward a more common purpose to leverage our combined expertise in shaping our nursing workforce while educating others on the health issues that ethnic minority populations face. Today, I would like to share with you areas where I'm proud that Nana Ina is making progress towards this goal. We recently published an article, Cultural Congruent Healthcare of COVID-19 in Minorities in the United States, a clinical practice paper from the National Coalition of Ethnic Minority Nurse Associations. This was published in September 2020 in the Journal of Transcultural Nursing. This topic was also presented at the October 2020 Transcultural Nursing Society Conference. The article highlights strategies towards greater health in our ethnic minority communities who have been so hard hit by the pandemic. Nana Ina recently co-sponsored a Native Nursing Summit with the University of Wisconsin-Madison School of Nursing. Their success through recruitment, retention, engagement, and mentorship are key parts of the STREAM program, which is one of a handful of nursing programs that have created strong relationships with local and state tribal communities to shape a culturally supportive program for Native students entering nursing. Expanding this concept further, an important project currently underway for Nana Ina is the development of an American Indian Alaska Native nursing student mentoring toolkit for nursing faculty. A wise Native nurse leader, Beverly Warren, who is Lakotan from the Pine Ridge Reservation, is helping to shape this project with her many years of nursing faculty experience. This is a collaborative effort in partnership with the Center to Champion Nursing in America. The toolkit will be launched via an educational webinar in 2021 and is an intentional approach to educate nursing faculty on how to support Native nursing students to be successful in the academic setting. The future can be daunting to consider how the Center to Champion Nursing in America and AARP could help facilitate more engagement. There are just so many new opportunities, and it is a challenge to consider how to impact the complex health and social needs within the American Indian Alaska Native communities. It really is impossible to discuss all of that in this brief session. However, I would offer you an important step in the process as we move forward, and that is to learn from and listen to American Indian Alaska Native communities. This is an important step to create a mutual partnership and vital to shaping a more promising future together. Thank you.
And finally, Dr. Jermaine Smith-Baugh of the National Urban League. Now, the National Urban League isn't a nursing organization, but talk to us about how you're involved in this issue, what you're doing with other social justice organizations, as well as other healthcare professional organizations to improve the situation.
That is an excellent question. So the National Urban League is an organization that has affiliates around the United States. There are 90 urban leagues in the continental United States. And when we look at the way that we serve community, health is one primary pillar for us. And when we think about the ways that we address our health concerns, it does require partnerships. And those partnerships include partnerships with nurses and nurses associations. So here in Broward County in Fort Lauderdale, Florida, there are a couple of examples that I'd love to share in ways that we have practically worked with our nurses association. One way that we have is with our baby shower. We operate one of the largest baby showers as a community outreach event that includes clearly pregnant women and their families, providing them with resources as well as information to have a healthy birth outcome. When we do this particular event, nurses are an imperative to making sure that this event is successful, because our nurses provide the education that is necessary for our clients, for the community, for the parents, for the fathers who are there. And it's just a really great opportunity for the Urban League and the Nurses Association to come together. But really unique in South Florida is our focus on cultural competency and health equity. So not only do we do a very large baby shower that is open to the general public, but we also do a baby shower that is focused on our Haitian American population. And our Haitian American Nurses Association partners directly on that particular project and that community event, providing the information that we need, particularly in the language that the respective clients and our community members feel most comfortable communicating their health concerns and their needs. Another really good example is our opportunity to work with nursing students, those clearly coming into the field. And we use those nursing students partnering with our technical colleges to be volunteers, particularly for our seniors and our elders in our diabetes prevention and diabetes self-management program. So there are a lot of great opportunities that the Urban League, particularly here locally in Fort Lauderdale, has found that has worked really well in partnering with our nurses, our nursing students, and our nursing associations. And we plan on continuing those partnerships into the future. I think that there are a couple of ways that the AARP and the association can come together to really help social justice organizations and nursing associations, as well as other healthcare professionals come together. I think a lot of times in community, we segment our roles, but COVID-19 and this time that we have found ourselves in has told us and showed us how much of an intersectionality we have related to health justice and social justice and economic justice. And not to mention, of course, racial justice. And I do think the more opportunities we have to be able to, one, have these levels of conversations will allow us to be able to share ideas and innovations that we're finding to work in community and be able to replicate them in other communities. Another opportunity, I do believe, is to ensure the fact that we have an accountable relationship. I think one of our previous panelists really shared some really great examples related to the way in which we have systems and partnerships that are already in place with our national organizations. But those also have to filter down to the local organizations doing the work on the ground. So making those relationships accountable, connecting the dots so that those who are on the ground doing the work know what is happening on the national level, and being able to share that good work across the board, I think are ways that AARP and other organizations such as that can help us to make sure that we are connecting those dots on the ground.
There's so much that we can do and hopefully we will do in the future. I applaud your efforts and thank you for participating on the panel this afternoon.
Wow, another important panel that is talking about how connected we are, how things are intersectional, and the beauty of us coming together. So a question that I get a lot is, when we are working on health equity issues, should it be a top-down effort where we're having CEOs and policies that are guiding what we do, or should we be doing grassroots efforts? And my response to that is that yes, it's top down, it's policy, it is CEOs, it is leadership getting engaged, and the grassroots feet on the ground is a really, really important part of the innovation. It's the people that are at the grassroots level that understand what is needed and what can be done. And we have gotten examples from multiple sources and organizations about what they're doing in their community. There's not one strategy that is going to work for everyone. Rather, we need to share best practices with each other so that we are getting ideas about things that may work in our communities, but every single community is going to be different. And you've gotten some examples of how communities are different and some examples of things that are working in individual communities. Wynn, what were your thoughts on this previous panel?
Well, there's so many opportunities. I might have broken the rule that I was not supposed to break. I don't know if I was breaking a rule or not, but I was participating in the chat here too, talking with ARP's multicultural leadership team, Edna, Yvette, and Shaney, and Veronica. Just one example that Dr. Jermaine Smith-Baugh was talking about were these baby showers in the community. And I really think that kind of program would be very beneficial for the campaign to be involved in, with our nursing community, with our action coalitions. Really, our action coalitions, that is such a great program for the action coalitions to be involved in, because it is about nurses being involved at the community level, and it could have really great policy impact too. And then we could also be working with our ARP multicultural leadership partners. So I want to, I'm going to go back to one point that was made in the chat function. And Piri, I'm wondering if you know about it. It's a concept that I haven't heard about. We haven't paid attention to it in the campaign, and but Dr. Monica McLemore from UCSF posed it, and it was more of an idea than a question. And she said that we, and I think she means the broader we, including the campaign, needs to be looking at cohort hires, not only. So I don't know what cohort hires means. Do you?
Yes, we've actually been talking about this at our school in terms of cohort admissions. And this is a way to theoretically mitigate that sense that a lot of students have when they're the only in their class, or maybe the only in their school as a hire. So this would be, if we're going to hire, well, yes, we are going to hire students of color. Can we make sure, let me say that differently, we are going to admit students of color and we're going to hire faculty of color, but can we make sure that we're hiring multiple people in a cohort so that there's this feeling of community and not being the only in your school or within your institution? So I would say that this is fairly a fairly new idea in nursing, and we've definitely been talking about it at our school. We haven't implemented it yet. I mean, there are some things that can get in the way of that, including in the state of California, we have Prop 209, which says that you're not supposed to look at race, ethnicity in admissions or hires. So then cohorting, how does that fit into the laws for the state of California? So there's some things to think about, but I am very, very intrigued by this idea, and have been doing a little bit of background work on that as well.
So I think that would be an interesting webinar to host in the future, to have an exploratory conversation about it, and the value, and what are some barriers, and how can we possibly address those barriers. And I also want to go back to the point you were making. So listen, we're being prompted to continue to talk because there's an issue going on with panel 3, so I'm okay with that.
Okay.
So in advocacy, in the advocacy world, in terms of making policy changes, I'm going to go back to the point that you started with, Piri, in our conversation right now, and that is, do you work in terms of diversity, inclusion, and equity? Do you work at the leadership level of organizations and policymakers, or do you work at the grassroots level? And the answer is yes and yes. And we actually call that, in advocacy, we call it grass tops and grassroots. So and it is important. It is very important. And the campaign has mostly focused our efforts very often on the approaching the grass tops, engaging the grass tops. That's really who's part of our Champion Nursing Council and Champion Nursing Coalition. But we're also smart enough, lucky enough, blessed enough to to have grassroots at the state level through our action coalitions and AARP state offices and other organizations that we engage. So we should definitely be tapping into all. And, you know, the conversation that's occurring on the chat is great. There are some questions coming in. Linda Burns Bolton also earlier, she was suggesting the value of working with high school programs for recruitment into nursing programs, for tapping into students of color, for recruiting into nursing schools. So the campaign agrees. And I would say that the reason we have been putting a lot of our efforts into mentoring for retention is that over the past 10 to 15 years, the numbers of recruitment into nursing schools has been very promising in terms of diversity and inclusion. It's been the graduation rates and the NCLEX passage rates that we wanted to help bolster in terms of more nurses of color entering the field. And of course, we also need to pay a lot of attention now to more diverse leaders in practice settings and at the faculty level. So Debbie Stamps from New York, who is a fabulous nurse leader from Rochester Medical School, was also pointing out in the chat that we need to be paying attention to the diversity of faculty as well. Many others are saying that as well. So there's another question that's come across my text. How do we balance LGBTQ and maintaining their security and rights? So, that's an excellent question, and maybe that was posed because of what I said, that I would believe that now, compared to 20 and 30 and 40 years ago, more LGBT people are more willing to share their identity when responding to surveys. And maybe the question has to do with culturally congruent care in healthcare and long-term care settings. It's probably has to do with that. I know that the American Society of Aging has a really fantastic LGBTQ cohort that pays quite a bit of attention to the quality of care, and oftentimes, unfortunately, the lack of quality of long-term care, especially for the LGBTQ community. So, Piri, any thoughts about?
Yeah. I want to answer this question going back to what we were talking before, the grass tops issue. So we talked about top down, bottom up. There's another perspective though that's really important, is allies bringing in the side. And I think that this is going to be important when we're talking about people of color and the LGBTQ plus community. And what I mean about the role of allies bringing in the sides is that there are a lot of times that we focus on only the issues that are directly important to us. And I think that we need to be broadening that. So this means that we have specific initiatives. One of our speakers talked about it earlier, that we need to have our hospitals designating themselves as LGBTQ plus friendly. And it's not that the hospital gets to decide whether they are or not. They get that designation from the LGBTQ plus community and the people that are working there, but we should strive for our organizations to have that designation. And then in addition to that, people who do not identify as LGBTQ plus need to be active in making sure that our patients, our staff, our faculty, our students feel welcome, and that their perspectives are important and can be heard. And that sometimes means speaking up. when somebody, I mean, we've had a few people talking about how they don't see what the value is in using preferred pronouns, right? We need to stop that from getting momentum. Like, our organizations need to make sure that this is part of our ethic, part of our mission, and that we as a community are going to say, whoa, we have designated ourselves, we have done this work to become LGBTQ plus friendly, and therefore that means that we are honoring this community and we're going to uphold those values. I would say that the same is true for supporting our students of color, that we really need white folks that are saying this is important and we are going to hold each other accountable for this sort of culture. So Wynn, what are your thoughts on that?
Yeah, I love that. It's very holistic, isn't it? Right? To go to think grass tops, grassroots, and what's the term from bringing in the sides?
I was thinking of allies that bring in the sides.
Bring it, allies that bring in the sides, right? Very holistic, and I think it is something that we should think more about and conceptualize. Right? We bring that concept into our work. I love it, and So I'm not a nurse, but I know that nurses, what I love about how nurses practice is that you're very holistic. And I think that you just offered that very holistic framework into the advocacy and coalition building sense. And so I think that would be really good for us to further develop, as especially that we bring in more of the LGBTQ plus voice. I like the plus. Um, and and another thing too about the LGBTQ being more for the campaign being more inclusive to the LGBTQ plus community is also the intersectionality, right, of uh, people of color and relationship identity, otherwise known as sexual identity, gender, um, gender identity as well. And and speaking of gender and identity, the pronoun, you know, if um, if the if we weren't at such a charged time in society, um, and knowing that we have to pay very serious attention to everything, especially with what went on in the Capitol last week. If we didn't have that extra, very serious challenge where we need accountability and reconciliation, um, over the last couple of years, I think the gender pronoun uh, conversation has been very prevalent, right? And so, and I think it warrants time and warrants our time and warrants our attention. And at AARP, we have a strategic employee resource group called PRISM, as in the rainbow. And a few years ago, we hosted several leaders from the trans community, and and after that, I added to my signature my preferred pronouns, because what I'm signaling to the trans community is that I'm an ally, and I try to be an ally, and I know in my heart I'm an ally, and I in practice um, always want to be a better ally to communities that need that. Um, and for me to be helping bring in the sides. So, so let me see if Aiden and Stacy have been sending more questions. What is available to schools? Oh, something, a very important resource I wanted to point out for helping to diversify nursing faculty and student enrollment at all levels of nursing education are grants from HRSA. And from what we understand the incoming Congress and the incoming administration will be putting an emphasis, even more of an emphasis on having more diversity in nursing at both the faculty and student enrollment level. And so that is something the campaign we will continue to push out. And maybe when we have that webinar on cohort hires, we could be bringing in, that would be the HRSA, the federal funding would be a potential, okay, thank you, a potential combination to add to how we can address the barriers that some states have about hiring and diversity. Jasmine has prompted me to remind our audience that on the campaignforaction.org webinars, we have a webinar on archive where we featured HRSA leadership talking about the funding that that is available, and to the schools that we work with, the Hispanic serving schools, the Native American serving schools, and the HBCUs, we would love to see more of those designated schools apply for more of those programs. Obviously, we want all of you to apply for those programs, but we were informed by HRSA that that these cohort schools rarely tap into the federal resources, and they are there. So,
Wynn, I have a question or a comment or something I want to talk about with you. Is that all right?
Okay, sure.
One of the things that's interesting in the conversations that we've had today, we've been talking about the challenge of the divisions that we see and also the challenges of the pandemic. I also see that in these really difficult times, there have been some really interesting thoughts that can potentially positively contribute to health equity. And some of those things that came up were one of our panelists was talking about telehealth.
Mm-hmm.
And I think that this has been something that we've needed for a really long time. The pandemic has made us hit the fast forward button on progress with telehealth because we want to prevent the spread of COVID-19. And so, in exploring telehealth, it may be that we have another way to get into communities and have more community interaction. Were you going to say something?
Absolutely. Yes, I'm going to say our audience is going to have to stay tuned for that topic. And I think we should, that's another excellent webinar that we should have. And when I say webinar, it would be more of like a regular webinar rather than the Health Equity Summit, although we can definitely be tagging that it relates to health equity. So let's return to that topic. We have had some telehealth webinars in the past, but it's been a while. And if we intersect it with diversity, inclusion, and equity and COVID, I think it would be an excellent topic for us to pursue. So I'm glad you raised
Awesome.
it. So,
piece,
well, actually,
go ahead.
Okay, you say that other piece and then wrap it up. Okay.
All right. Awesome. So along the lines of telehealth is also this notion that we're connecting virtually more than we ever have. And so that also provides an opportunity for us to have partnerships that maybe we didn't think were, logistically possible. So I would say using this sort of platform in the future to have cross-country, cross-community collaborations and partnerships.
Excellent. So Piri, I'm turning this back to you.
All right, wonderful.
Okay, we're moving on to our final panel of the day. This is one where we have asked leaders from different associations and hospitals and health systems about what policies they have in place to address health equity. This can include addressing structural racism as well. Our facilitator for this panel is one of our favorite friends of the campaign, Dr. Alicia Georges, Director of Nursing at Lehman College with the City University of New York, and is also AARP's past National Volunteer President. With Dr. Georges today are Dr. Beverly Malone, President and CEO, National League for Nursing, Dr. Vernell DeWitty, Director for Diversity and Inclusion, American Association of Colleges of Nurses, Dr. Janice Orlowski, Chief Healthcare Officer, Association of American Medical Colleges, Dr. Linda Burns-Bolton, Senior Vice President and Chief Health Equity Officer, Cedars-Sinai Medical Center, Dr. Robin Begley, Chief Executive Officer and Senior Chief Nurse with the American Hospital Association. Dr. Georges, please take it away.
Thank you, Perry, and thank you to Dr. Susan Hassemiller and Dr. Susan Reinhardt for inviting me to join you in this very, very critical conversation today. And the conversation and the work that we need to do in the months and years ahead. As we know, the COVID-19 pandemic uncovered the gross injustices in our healthcare system. African Americans, Hispanics, Native Americans are more likely to die from the virus than white people are. And the horror that continues to occur in our nursing homes is outrageous. We have so much to do to transform our nation's nursing homes. And I echo what Susan Reinhardt has said. 40% of the COVID-19 deaths have been from people living and working in nursing homes. That's outrageous. And both the residents and staff who have died are people of color. We have got to do something about this. The beginning of the pandemic kept us all at home. And while we were there, we also witnessed the brutal killing of George Floyd by police officers. That set in motion our present day racial justice and equity movement. Thank God. This has made us all stop and take a look at how our institutions help shape and promote the racial inequities in our society, and in particular in nursing and in healthcare. So that is what we would like to talk with our leaders who are here with us today. We will go in and I will call on first Dr. Malone and Dr. DeWitty. So let's start with you two. What diversity, equity, and inclusion policies are in place in your organizations? And the second part of that question is, and can you especially focus on how you work with your member schools of nursing to adopt diversity, equity, and inclusion policies and practices? And then let us know, how do you think that is going? And what else needs to get done?
Well, I'll start. Thank you for letting me be here. I'm delighted, Bev Malone. I would say that it has to start with your basic mission statement. You have to have something built into the system. That's how structural racism is. It's built into the Constitution to some degree, especially when it was 3/5 human. So it's built into our mission statement. The National League for Nursing promotes excellence in nursing education to build a strong and diverse nursing workforce, to advance the health of the nation and the global community. And so when you were talking about the COVID-19 pandemic, it isn't an issue for here in the States. It's a global issue. And so that built into our mission statement is very important. The other thing is where we build it in is terms of our core values. And all of our schools are aware of those core values. All of our programs function, of course, according to those core values. There are 4 core values: caring, promoting excellence, health, healing, and hope,
in response to the human condition, integrity, and we know that we could use some integrity in this country right now, respecting the dignity and moral wholeness of every person without condition or limitation. Diversity and inclusion. It's not just enough to have diversity. You've got to add the inclusion piece, affirming the uniqueness of and differences among persons, ideas, values, and ethnicities. And finally, excellence, which you can't have excellence without having diversity and inclusion. It just won't work that way. And so excellence is co-creating and implementing transformative strategies with daring ingenuity. So those 4 core values are in everything we do, in everything that our schools know about the NLN. It is so critically important that they are etched in glass around our boardroom. Anyone who comes and works at the NLN, all of our members who come, that's what they see, that's what they know about the National League for Nursing. So that is an important way because it's a structural issue. It's about putting it into the shape and form of everything that we do with our members, with our educators, with folks who are not members of the NLN. It is there. So let me turn it over to my colleague, Vernell.
Okay, thank you, Dr. Malone and Dr. Georges. It's a pleasure for me to be with you this afternoon and to briefly share with you some of our work as well as our approaches that we're taking in terms of increasing diversity, equity, and inclusion, which are central to AACN and its strategic plan. I'll begin with, of course, it's embedded in our mission statement. I'd like to focus in on a position statement that was endorsed by AACN members in 2017. And this position statement was intended to articulate the vision and principles of AACN and it's associated with the values of diversity, equity, and inclusion. And I'd like to focus in briefly on the 3 key areas in the position statement that, of course, you can find on our website. The first key area is to improve the quality of education by enhancing capacity of academic nursing to maximize the learning experiences and opportunities for students and faculty. And of course, this is important in terms of the learning environment and wanting to have a more diverse learning environment with persons from different experiences, perspectives, and backgrounds. The second key area of the position statement addressed pervasive inequities in healthcare. And by doing that, ensuring the preparation of nurses and other healthcare professionals who are able to meet all the needs of our individuals and in our society that is becoming increasingly much more diverse. AACN recognizes the impact and the changes in the demographics of the US population, a health system that is challenged by workforce shortages, and also the persistent health disparities and inequities. We also recognize how social determinants in health create these inequities. And when coupled with the distribution of money, power, and resources, that become the primary contributors to the inequities that we envision and that we see. The third key area of our position statement is to enhance the civic readiness and engagement potential of nursing students who will be in the position of leadership in healthcare as well as in society. The desired nursing workforce that will result from a more diverse and inclusive school of nursing will be better prepared to advocate with and for others, being able to engage with community leaders and work to achieve an equity in healthcare and well-being. You asked how we engage with our member schools, and I'll speak to it in 2 broad categories. The first, what have been our efforts to diversify the nursing workforce? A national study was conducted in 2014 by Urban University of Health, and it identified holistic admissions review as a proven strategy to increase diversity in enrollment of health profession schools, not only nursing, but medicine, dentistry, pharmacy, and public health. Fundamentally, holistic review is about mission-driven admissions, whereby you assess applicants in a manner that reflects upon the characteristics that are most important for persons to become future nurses. Holistic admissions review workshops that we have conducted have addressed the increasing need for underrepresented students and to increase the enrollment of underrepresented students in schools of nursing. In December of last year, 2020, AACN released a white paper entitled Promising Practices in Holistic Admissions Review and Implementation in Academic Nursing. Based upon the work that we had done over the past 2 years in holistic admission review, we believe that we've added to the body of knowledge that should inform academic nursing in terms of looking at how do you increase the diversity of the enrollment in schools of nursing and thereby increase the diversity of the nursing workforce. In terms of member education, which is the second area that we have addressed, and I'll speak to 5 major initiatives that I think are really important. First, this year, starting this month, we will launch a new offering, the Diversity Leadership Institute. This institute is designed to stimulate strategic thinking and impact change at the school level. It will increase awareness while building school skills and the capacity to engage in discussions and issues surrounding diversity, equity, and inclusion. Participants in the workshop are recommended by their schools of nursing and will hopefully return with an agenda and a plan to advance diversity, equity, and inclusion. Last December, AACN hosted its first Diversity Symposium. It was a virtual conference offering for faculty and staff engaged in meeting the needs of diverse students. We have also offered workshops on unconscious bias to increase knowledge, skills, and attitudes in recognizing and becoming mindful of unconscious bias in teaching learning environments, as well as in nurse-client interactions. We have also formed a leadership network, which is composed of members from representing their schools to explore innovative approaches to enhancing diversity, equity, and inclusion in academic nursing. And it's through this formation of a community where we hope to promote what we know about diversity, equity, and inclusion, and to move it to the local level. 2 years ago, AACN developed a climate and culture survey, which is designed to help schools learn more about their environments, how it influences students, the experiences, and the outcomes. The survey targets not only students, but faculty and staff. We are in the process of beta testing this survey, which is a web-based, mobile optimized survey that ensure that the data being collected is of the highest quality. Now, the second part of your question, Dr. Georges, was, well, how is it going? So I'll tell you, based upon what we are seeing in terms of the level of engagement from the member schools. First of all, we know that our member schools, which includes faculty, students, and leaders in these schools, are highly engaged with the topic of diversity, equity, and inclusion. The evidence that we have for that is that in that first diversity symposium, we had more than 800 persons register for that 2-day online virtual event. That was a bit of a surprise for us, but it says how important these topics are to academic nursing. A second indicator of the importance of this work and how it's going is the rapid growth in our diversity, equity, and inclusion leadership network. We have now more than 100 members. There's opportunity for more growth, and we hope that before long, each of our 800 plus member schools will have a member of that group. In terms of the holistic admission workshops that we have offered over the past 3 years, more than 1,500 persons have attended these workshops, which are offered at school locations and presented upon the request of the school. We initiated last year a Diversity Digest newsletter that is issued electronically on a quarterly basis. And with each issue, we have continued readership in the circulation.
Dr. DeWitty, you have given us quite an impressive, list of what AACN is doing. We'll now like to hear from Dr. Olowski about what is happening with the medical colleges. Dr. Olowski, what are they doing about equity, diversity, and inclusion?
Dr. Georges, thank you very much. And to the organizers, to the nursing community and AARP, I appreciate very much the opportunity to talk on this critical subject. The Association of American Medical Colleges is a professional organization that includes the 155 medical schools in the United States, 17 medical schools in Canada, as well as 400 of our academic teaching hospitals. In addition, 70 specialty societies. And so we look at the AAMC as the organization that encompasses all of academic medicine and medicine writ large. I would tell you that the AAMC has been involved in diversity, equity, inclusion for decades. I would like to highlight Dr. David Acosta, who is our chief in this area. He's done wonderful work, he and his group. And I would recommend, if you have an opportunity, to take a look at our website, which is aamc.org, that you would see some of our webinars, some of our statements, some of the work that we've done. I would tell you, to quote you, Dr. Georges, we have so much more to do. We have so much more to do. We have been working on this for decades. We have more to do. Let me just highlight some of the areas that we would like to point out to you. First of all, in regards to pipeline, we believe that there is work that we need to do for pipeline to increase the diversity of individuals who come into medical school. And we continue to support a summer health professional education program, which is for all of the health professional programs. And I believe that all of us need to be committed to these pipeline programs. Secondly, when we take a look at our medical schools, we have made it part of our accreditation that you must not only take a look at diversity in your matriculants, but there is also over the last couple of years, we have actually required medical schools to demonstrate to us that they are involved in a pipeline program to increase diversity. We have nearly all of the medical schools in the United States undergo a holistic admissions. So that we're not just looking at the individuals who score at the very top of, say, the medical college admissions test or have the highest GPA, but that we look at the totality of the individual who's applying, that we look at the totality of their scores, their accomplishments, and how these individuals can fit into the class. And I would say that as we take a look, we have seen progress in increasing the number of women in medicine. We have seen increase in the number of Asians. We've seen increase in the number of Hispanics. We have failed. We have not seen an increase in the number of African Americans. Although there's a slight increase in the number of African American women, overall, this is not something to even say we're doing well. We have significant problems, and I think as we take a look at this, what I would say is that we have said
in some ways we've tried to support the individual, and it's how can they be stronger, how can they run faster, how can they be better, how can they, present themselves. And I think what we see is that we not only need to take a look at pipelines and the requirements for medical schools, but we now must turn to our institutions. And quite frankly, we have structural racism, and that there's no other way to say that other than to say we have work to do on our institutions. We have a program that we are looking at where we are talking about institutions and what they can do to change their culture. And we believe that it starts with an environmental scan by taking a look at what your institution looks like. Is the cultural diverse? Is it inclusive? Is there equity? And the answer overall in healthcare is no. I'll just pick out one particular issue. The National Academy of Medicine, approximately 13 months ago, came out with a report that talked about harassment in medicine, and harassment both not only in all the STEM fields, but that medicine, and this is truly a terrible mark on medicine, that we have the highest amount of harassment within medicine. So we have structural problems throughout our institutions that we must address. One of the things that we are strongly recommending is that all of our institutions undergo a diversity and inclusion strategic planning. We do have a kit. We do have webinars on our website. We are talking about this throughout our institutions, and it's not just the medical schools, it's the medical schools and the hospitals. And I would tell you that it starts with an environmental scan, but really what it starts with is leadership. It's with a leadership commitment to make a change. And so the last thing that I would say, and it's already been highlighted in this panel, is that we have significant racism and inequity in healthcare delivery. And certainly this pandemic has shamefully highlighted that issue. And so the question really is what can we do as academic medicine in not only bringing diversity and equity and inclusion to within our ranks, but what can we do to take a look at the communities? And this is not what can we do to help the communities, it's how do we partner with our communities? What are the opportunities that we have to change the inequities that we see in access and the inequities that we see in outcomes? And I have to say that there is some reports, and in fact, there was a report this week that take a look at outcomes that are better when a physician, a diverse physician, African-American physician is involved in, say, the delivery of an African-American child. And so we really have to take a look at this and say, what are the structural problems that are causing this? Not only what are the structural problems, but what do we do to change this? And I would say that we are building in medicine on a legacy that is nothing to be proud of. We have had inequity, and we have excluded individuals, whether it's from our professional groups, whether it's terrible research that we have done in the past, whether it has to do with admission policies. And so I would tell you that we are decades along the road of looking at pipeline, we're looking at holistic admission, we're looking at how we make it mandatory in the accreditation process, but we have more work to do.
Thanks so much for that, Dr. Olowski. Now let's go to the practice setting. Dr. Begley, how has the American Association of Nurse Leaders addressed the issues of structural racism? And how do these policies and practices address having a more diverse workforce? And how is the American Hospital Association addressing these issues for all healthcare systems workforce?
Thank you, Dr. Georges. It's an honor to be here today, and I am, just delighted to be here to address this very serious issue. Diversity and inclusion is and has been a strategic priority for AONL. we address this through education, advocacy, and community. We believe that it is really critical for the nursing workforce, including nursing leaders, reflect the patient population and communities served. And as I would agree with an earlier comment, our communities are becoming more and more diverse. We have resources such as our position statement and guiding principles to help nurse leaders implement and foster workforce diversity and inclusion initiatives within their organization, as well as addressing institutional bias and examine how this has resulted in inequities in healthcare. And this is difficult. These are difficult conversations, but as COVID-19 has shown, it's a conversation that is long overdue. AONL advocates for increased funding for programs that recruit and retain nursing faculty, grants, loan forgiveness for programs aimed at increasing diversity and inclusion in the nursing workforce, and academic practice models to prepare students for practice. Last fall, our president, Marianne Fuchs, convened a diversity and inclusion committee to do the important and really detailed level work of examining all of our association's practices and policies. And this is soup to nuts. This is looking at internally at our organization and staff, as well as membership. It's inward facing and outward facing, including the composition of the AONL Board of Directors to ensure representation from diverse perspectives, including, race, ethnicity, practice settings, etc. And this is work, and the speaker to follow, Dr. Linda Burns-Bolton, is very familiar with this work. She was a part of that when she was leading AONE at the time, now AONL. But this process needs to be iterative. We need to continue to do the work. What are the problems that still need addressing? Nursing is still primarily a profession comprised of white women. We have a long way to go to achieving diversity within nursing, and especially with nursing leaders in the C-suite. We're currently conducting another survey. We do it about every 2 years, and the numbers are really discouraging when we look at, the diversity among nursing leaders. We need to change our approach to diversifying the pipeline for nurses. Entrance to professional schools by racial minorities has stagnated, or in some cases has dropped at the very time when we need more diverse nurses. Programs need to create relationships starting in the elementary schools and throughout high schools to identify students who may benefit from, coaching, from prompting and encouragement to pursue nursing careers. The cost of nursing education are prohibitive for many students. Diversifying the talent pool will require additional investments to defray nursing school costs, and this needs to be, a platform that we are advocating for. Many hospitals, we're finding right now that many hospitals are delaying their planned leadership transitions as their organizations manage COVID-19, which, along with the social unrest, has really cast a new light on potential successors. So rather than sticking to old succession plans set to roll out, health system leaders are having conversations to make sure that their organization weathers the pandemic and causes the boards, the hospital and health system boards, to revisit what type of executive is best equipped to lead their organizations, not only out of the pandemic, but also to reevaluate who best represents the communities they serve. So what should the board and the C-suite leaders look like? Real briefly, I just wanted to touch on what the American Hospital Association, how they are addressing these issues. The American Hospital Association's Institute for Diversity and Health Equity, IFD HE provides many resources and shares best practices to empower healthcare organizations to provide equitable care for all persons. The AHA created a health equity, diversity, and inclusion measures for hospitals and health systems dashboard. It's a mouthful, but it's a really great document that provides healthcare leaders with the necessary information, tools, and resources to advance health equity and the journey. This is, as I mentioned earlier, not something that you begin and it ends in a short period of time. It really is iterative, and we need to, expect that this will take some time, but we need to get moving on it. These great resources are found on the website. And real briefly in closing, what are promising practices in health systems and problems that still need addressing? I think, as we've stated before, that our immediate problem is really around educating the public about COVID-19, the symptoms, guiding the public to test, sharing trusted information about the vaccines. We know that right now that is a concern nationwide. And the best people to deliver these messages are trusted sources of information, faith community leaders, as well as, leaders in healthcare that are trusted locally by their communities rather. Hospitals are using their existing community partnership to strengthen prevention efforts. We are leveraging community channels to not only keep communities safe, but also expand our reach to underserved areas. For example, faith-based leaders are reinforcing the importance of staying home, despite the desires of members to congregate, and we know that that's a natural human impulse. Food pantries are being mobilized to help amplify critical health and prevention information while still serving vulnerable populations. And community health workers play a vital role in distributing educational materials as well as food, other essentials to those who need them. Thank you very much for the opportunity to be here today.
That perspective, Dr. Begley of AONL and AHA. Now I get to turn to my dear friend, Dr. Linda Burns Bolton. Linda, much of the ideal practices and policies that Dr. Begley described are what you're attempting to get done at Cedars-Sinai Hospital health system. Is that correct? And so I'll ask you, how's that going? And what is going well and what still needs to happen?
So thank you very much for allowing me to present briefly about the work that we're doing here at Cedars-Sinai. Can you guys hear me? Okay. And we were having some technical difficulty earlier, and I just want to make sure you can hear me, because I want to talk about an underlying theme that I hope will end this session, but before Sue comes on to talk about the future of nursing, is that we're committed to excellence in human caring. Excellence in human caring. That requires all of us to be willing to identify what are the barriers to excellence in human caring and what are the enablers. And we know that an enabler is that we let everyone who thinks they have something to give to promote human caring into the health professions. That includes the nursing profession. What I didn't hear today in terms of this wonderful team was from the group of men in nursing, because they have been pushing that 2-ton ball up the hill about whether or not men can be registered nurses, and they can, and they are, and they're doing very well, not just in anesthesia also, which is why the majority of them are. Second, we must engage and prepare our employees, our students, our faculty, our residents, volunteers, and representatives from the community in our quest to achieve health equity. And to achieve health equity requires all of us to be engaged. We must commit to engaging the community, and that means that from everything from civic organizations to federal organizations, state and local organizations. We have nothing about me without me, as dear Dr. Don Berwick used to say. And we cannot hope to achieve health equity without engaging a very broad group of individuals. So that is the work that I think we need to do. I do want to call your attention to an article that was written in the New England Journal of Medicine Catalyst in September of 2020. I almost said this year, and we're already in 2021. It's called Healthcare Equity from Fragmentation to Transformation. And what I liked about this article was that it really hit home we've all been talking about the various aspects of diversity and inclusion and trying to address health equity issues that abound in our country and in the world. But it's been a very fragmented approach. And so how do we get to an approach that is much more inclusive, that says we welcome everyone to the table, and that's sometimes hard to do. We all have our individual bias. Anyone who says they're not biased is not telling the truth, or they're not being very they haven't looked at themselves truly, because we all have our own individual biases. How do we move from that spot of our own individual biases to what is best for humankind? What is best for humankind? And what is best for humankind is that we all are engaged in the work of human caring. And that takes a lot of effort and a lot of energy. I've been in this profession a long time. And in June of this year, I would have graduated from Arizona State University in 1970. God, I'm old. Nothing Alicia says. But it is quite a joy to be a registered nurse. It's a joy to be a registered nurse leader, but it's much more of a joy to be a part of a team of health professionals that is inclusive, and it's committed to excellence in human caring. So that's what I will leave you with. And Alicia, turn it back over to you.
Thanks so much, Linda. Let's wrap this up with some discussion about research. Can each of you who would like to share with us what policies and practices your organizations have put in place to ensure that research grants are equitable and they also reflect the need for nursing to create a more equitable healthcare environment in practice, in education, and in research? I'll give each of you 1 minute, 1 to 2 minutes. Dr. Malone, let's start with you.
Thank you, Dr. Georges. There is this whole issue around research in nursing education about whether it's really valid. And so the National League for Nursing believes strongly that research is critical in nursing education, and that every nurse who is an educator should be also have some responsibility toward that idea of how do we make sure that the teaching that we do is based on science. And to do that, that means nursing research. I don't believe that in education that you just throw something up against the wall, see if it sticks, and then you teach. No, it's based, just like clinical practice is based on educational and practice research. Nursing education is based on research. The NLN is so committed to that, and that's what we're doing. We're giving out scholarships and grants and making sure people have opportunities who are educators so we can increase and improve nursing educational research.
Thank you, Dr. Malone. Dr. DeWitty?
Sure. Dr. Georges, I'll add 2 points to the conversation. The first is that we really need to have more research to examine what are the facilitators and the barriers to nurse faculty, especially faculty of color. We know that non-white, non-Hispanic nursing student enrollment in 2019 was about 35% in nursing schools who participated in our annual survey. At the same time, faculty of color represented only 19% of nursing school faculty. That's something that we really do need to understand and to investigate in greater detail. A second point is looking at how do we increase and enhance the pathway and the pipelines for more PhD prepared nurse scientists. So we really do need to enhance that. We did start a foundation at AACN for academic nursing, where we do make awards to faculty who are interested in conducting research study. And we make those awards to faculty with a focus on some of our own strategic directions. And that's a new initiative for us as well. Thank you very much for allowing me to share those 2 points.
Dr. Lowski, what about AAMC?
So thanks for the opportunity to comment on this. First of all, I think that what we need to do is to, again, take a look at the culture of our institutions and make sure that harassment and the issues of welcoming everyone into not only patient care and education, but also research. We've worked with the NIH and we support the work that they've recently done about having other avenues so that the individual who's involved in research isn't just dependent upon their supervisor or the physician who they're working with, that they have multiple other opportunities. And then I would tell you that as we take a look at research, one of the things that we see is that there are sort of what I would call the hard metrics, but then there's the soft metrics. And we find that individuals who start out and start in research, but end up being successful in research have access to more mentors in their institution. They may have access to equipment and labs even before they are funded, that they have help with publishing papers. And so that we have to take a look not only to make sure that there is equity in what I would say is the hard measures, how many faculty members do you have, how many are writing grants, but we need to take a look at all of the other ways that institutions work to make a successful researcher and make sure that's available to everyone.
Dr. Burns-Bolton, what about Cedar's health system, Cedars-Sinai Health System?
So we are currently involved in the PCORI research grant. We have lots of different projects, but I want to talk about the PCORI project because that project says the fastest growing segment of the population in the United States are those individuals who are 80 and older. 80 and older. And how do we allow them to live in place instead of being put into a nursing home? How do we support them? And what are the differences that we can do to keep them get them healthy and keep them healthy so they stay out of our hospitals? Because those are the worst places. I work in a hospital and still say it's the worst place to be because you increase your likelihood of dying. So what that PCORI research grant has is interesting in that it has 5 different levels of nursing professionals, those individuals who are nursing students, those individuals who are master's prepared, doctorally prepared, and clinical nurses in the clinical settings and acute care settings, and nurses in the population health settings. And coming together, it's a 3-year grant from PCORI, and we are very excited about it. We have 150 different sites that we are working with. And these are individuals who are aging in place. They are not in nursing homes. They're aging in place. And we think that that's the model that we should continue to support. And we're gathering evidence about what makes it work and what doesn't make it work. Robin?
Well, I would like to say, unless Dr. Begley had anything else she wanted to add.
I just wanted to add that, like my colleagues at AACN and NLN, we believe that nursing leadership is a specialty unto itself that needs to be based in science. We do have a foundation that supports nursing leadership research, and I know we're getting, short on time, so that'll be it for me.
I want to say thank you to all of our panelists. This was such a very important conversation. And so I think I can say for Dr. Sue Hassmiller and Dr. Susan Reinhardt, this was only the beginning. The Campaign for Action looks forward to working with each of you and all of you together in the months and years ahead This is not going to happen tomorrow. We got work to get done. So at this point, I'm happy to turn the mic over to our campaign director from the Robert Wood Johnson Foundation, Dr. Susan Hassmiller. Sue?
Wow. I mean, I don't even know where to start except to say, yes, Alicia, you are right. This is only the beginning. We have a long way to go to have a more equitable healthcare system. And to do so, we need everyone here today and so many organizations to commit to helping to diversify the nursing workforce to achieve health equity. I am Sue Hassmiller, and on behalf of the Robert Wood Johnson Foundation and the Future of Nursing Campaign for Action, I thank you so much for being with us today. First and foremost, racism and injustice have no place in our country today. The historic times in which we find ourselves today more than ever illuminate the inequities. And we also see that the unique role nurses can play in helping achieve health equity. Now more than ever, there's an urgent need to address barriers to health equity and create better systems. Systems in which all people have an opportunity to live as healthy and as well as possible. 2020 provided us with enormous challenges and unique opportunities where nurses can and do show up as leaders, especially in policies that address social determinants of health, inequities, and the nation's overall well-being. As today's program underscored, having a more diverse nursing workforce, among other actions, will help us achieve this very important goal. One of the hats that I wear, as we mentioned, gives me the privilege of working with the National Academy of Medicine, otherwise called NAM, the Committee on the Future of Nursing 2020-2030 report. Let me give you an update of its status and plant some seeds with you about what we have planned leading up to and following the release of this really important report. As background, on July 30th, the NAM announced a delay in the release of its second Future of Nursing report to the spring of 2021. The shift in the report timing came after the NAM updated the publication's statement of task to consider newly emerging evidence related to the COVID-19 global pandemic and includes recommendations regarding the role of nurses in responding to the crisis. Initially planned for the release of December 2020, the Future of Nursing 2020-2030 report, supported by the Robert Wood Johnson Foundation, has now been expanded to include the dramatically changed context and rapidly deployed changes in clinical care, nurse education, nursing leadership, and nursing community partnerships as a result of this pandemic. This content is in addition to the anticipated report recommendations that chart a path for the nursing profession to give everyone a fair and just opportunity for health, reduce health inequities, and improve the health and well-being of the U.S. population in this century. The report is in a revision now, and we anticipate its release to be around May of this year, hopefully by Nurses Week. To that end, the campaign has planned a number of virtual events that I hope you'll attend. You're cordially invited, all of you, so please mark your calendars now. Our next Health Equity Action Forum, entitled Financial Wellbeing, Nursing as an Avenue for Financial Security, occurs 3 weeks from tomorrow on February 3rd, 2021, 11 a.m. to 1:30 p.m. Eastern Time. This forum will discuss nursing as an effective career ladder for people from underserved communities achieving financial security. 3 weeks later, on February 24th or 25th, 2 to 5 p.m. Eastern Time, we'll host the Future of Nursing Passion, Progress, and Purpose so we can do the following. Honor the sacrifices and contributions made by nurses. 2, reaffirm the critical importance of the power of nurses at this time. And 3,
build momentum and anticipation for the National Academy of Medicine's NAM release of the Future of Nursing 2020-2030 Consensus Study, a blueprint for the largest group of health professionals, nurses. Recognize and acknowledge all stakeholders of the Future of Nursing Campaign for Action's progress since the 2010 release of the Future of Nursing report called The Future of Nursing, Advancing Change, Leading Health. And we will anticipate this next report. Then in March, our third Health Equity Action Forum entitled Individuals, Family, and Community will occur from 11 a.m. to 1:30 p.m. Eastern Time on Tuesday, March 30th. During this event, we will celebrate Women's History Month and the intersection of diversity and inclusion, and we'll hear about several nurses of color who shaped the profession, including Mary Seacole, Sojourner Truth, and Harriet Tubman. We will also discuss the Campaign for Action Health Equity Toolkit and how nurses are using to support historically underserved communities. As noted above, in early May, we will meet you again when the NAM releases its report, Future of Nursing 2020-2030 Consensus Study. The campaign will host a set of virtual conversations with key stakeholders to educate, engage, and activate stakeholder interest in promoting a culture of health, well-being, and health equity, and importantly, to encourage stakeholders to discuss and explore this new report. And here's the virtual drum roll, please. Last but certainly not least, we'll culminate the Health Equity Action Forums and the new NAM report convenings with a major stakeholder event occurring on June 3rd and June 4th. At this virtual meeting, all of us working together will chart the path forward to implement recommendations from this new report with all the key stakeholders there. Again, all of these meetings are open to the public, and we hope will join others who will attend, including our action coalitions, campaign leadership and committees, nurses who work in every practice setting, and social justice stakeholders, just to name a few. As you can hear, the audiences for these convenings are deep and wide. The time is now for nurses to be more directly working with as many sectors of critical stakeholders as possible. We encourage you to visit our website as the campaign will continue to provide updates about the Future of Nursing 2020-2030 report as more information becomes available. And if you miss the engagement webinar, you can read about that important event as well as the campaign website post titled Advancing Health Equity in the Era of COVID-19. So on behalf of Susan Reinhardt and me, I want to thank our MC of the day, Dr. Pierre Ackerman-Barger, and the team who organized this, Jasmine Cooper, Yvette Penna, Wynn Quinn, Scott Tanaka, Laura Diamond, Aiden McCallan, Peary's Dr. Adriana Perez, Lisa Martin, Regina Eddy, and our favorite honorary doctor, Barbara Nichols. On behalf of RWJF, I want to extend my sincerest gratitude to our sponsor for today's forum, AARP's Multicultural Leadership and the team's Senior Vice President, Ms. Edna Kane Williams. Thank you again, and we look forward to seeing you on February 3rd. Until then, stay safe and stay well.